Hey everyone, Dr. Ammon Hills. Today we're talking about muscle knots, what they are, how you get them, and what you can do to treat them. I'm a pain management doctor in northern Utah, and I see muscle knots all the time. The most common area where these are happening is really the neck, shoulders, and kind of upper back area. These can happen anywhere, but that's where we're focusing today, is kind of that region. So first of all, what are muscle knots? Why do you get them? Why can they be so annoying? So muscle knots basically can happen because of a few different reasons. Usually it's after some type of injury or other activity where your muscle gets a little bit strained, and then there's some difficulty with that muscle healing. And so what happens is you get this kind of disorganized area of muscle that is leaky. The thing that it leaks is this chemical that causes the muscle to contract all the time. That chemical is called acetylcholine. Just know that there's leaky, disorganized muscle that is always contracting, which is why that muscle knot is so tight and taut. It's important to know what causes these muscle knots, because that is how we treat them. And these muscle knots, when they're real painful, a lot of times when we press on that area, they may even refer pain to a different part of the body. So if you press on your muscle knot here, it may shoot pain into the shoulder or down the back or up the back. And so that's another kind of key characteristic of these muscle knots. Another reason why these are happening is likely due to posture, the way that we're positioning ourselves. If our posture isn't the best, then that may be putting extra stress over that area where it has continual pressure and strain where it just can't heal. So definitely now more than ever, with all the electronic devices that we have, we can see that tablets, cell phones can put us at positions where we have poor posture. So if I turn to the side like this, then really the ears should be kind of over the shoulders, right? Whereas if our shoulders are kind of either lean forward, if we have our phone and we're just kind of looking down like this, you can see that that angle isn't going to be a good angle to be in for very long. And so, no one's going to be looking at their cell phone, in the proper position like they probably should, up here. But really that's going to be less strain on your neck and shoulder muscles in this position. Also, some people are doing things at work where they're in a certain position the whole day, either at a desk, factory, wherever it may be. All jobs have certain activities that you have to do frequently, and sometimes those jobs and positions can lead to chronic pain. That brings us to another good point. If you do notice that your job is requiring certain positions that may be making your pain worse, go talk to your employer. A lot of employers will have what we call ergonomic options that may help your posture while you're at work. Some of those include getting a different type of chair, a different type of desk, maybe one that can even stand, where you can stand up and work, making sure that your computer monitor is at the right height, and so forth. So there's a lot of different changes that sometimes they can help with to help so your body can heal. Okay, so now let's get into some treatments, some ways that we can get rid of these nasty muscle knots. So the first treatment we're going to talk about is simple but so important. This is stretching. And so we're going to talk about some simple stretches that we can do of the neck and kind of shoulder area to help get rid of some of those hard to get areas of the muscle knots. So one of the first stretches that we'll talk about is dealing with the rhomboid muscles. So those rhomboid muscles are the muscles that are in between the shoulder blades, okay? They're clear back here. So you can see how difficult they can be to get to sometimes. A good stretch to get to these muscles is if we kind of reach out in front of us. We're gonna not just kind of reach out in front of you, but almost push out in front of you. So then you can feel kind of that muscle stretching, and then kind of gently lower your head. Hold it there for 15 to 20 seconds. You can do that a few different times, and that'll help kind of stretch that specific area of the rhomboids. So there's a lot of muscles in the neck area and shoulders. If we want to get this one right here, we're gonna look away and then grab the back of our head and just gently kind of pull till we feel a stretch right in that muscle. We hold it there for about 15-20 seconds and then kind of relax. Repeat that 2 to 3 times for each muscle. So similarly, For some of the other neck muscles, we're just gonna kind of gently pull our head to the side here, and now I can feel more of those muscles on the neck, getting a good stretch. Holding that for 15 seconds or so, and then repeating 2 to 3 times. So these muscles are super excitable or easily irritated. Because they're so easily irritated, because they're so leaky, it may be painful doing these stretches, right? But what that's doing is that's helping to relax and stretch that area. So it's okay to feel a little bit of pain or discomfort when you're doing these stretches. That's normal, okay? And it should improve over time. Just important to always continue doing these stretches, because that's one way that's gonna really help these to calm down and to eventually go away. So that's one form of stretching, but what other ways can we utilize to stretch the muscle, right? And so there's different techniques. One of them would be where you're doing a stretch and then put a little bit of pressure over the muscle where you're stretching. What that does is that's gonna put more tension over the muscle, where that's gonna give it an even better stretch. So that's just another way to help stretch, especially that area that you're trying to get to. This can sometimes be better if you have a partner or someone that can help with this, because sometimes it's a little bit tricky, you know, trying to get the stretch and pushing on the area at the same time. Other things that could be used include devices such as a Theracane. What that is, it's a little massage bar where you can put it over that tender area and kind of massage the area, which also puts pressure over the muscle, providing a type of stretch to the muscle. Another thing that sometimes we'll utilize is a cold spray. And so this could be something like a biofreeze, where we're spraying that muscle knot with this cold spray and then providing the stretch. This can sometimes help when it's really painful to do the stretch. Helps kind of take away some of the pain and allows us to do a little bit more aggressive stretch. So a lot of these things you can find online. I'll put the links in the description below if you're interested in that. The next treatment we're talking about is a treatment that you'll probably have to go to someone else to get help with this. So a lot of times when patients have done stretches, they've done other exercises, and it's just not getting better, it's affecting their lives, their function, everything, then they come to me and we talk about other things that we can do in addition to their ongoing stretching, such as trigger point injections or needling. Back to the reason why you have these muscle knots in the first place is because you have this disorganized tissue, right? That's always leaking that chemical, why it's so contracting and tight. And so what an injection helps with is they think it's the actual needle passing through the muscle that can help break up that disorganization and help stimulate a healing response. They found that it doesn't really matter what we inject into the area. So injecting a steroid isn't gonna be any better than injecting normal saline or lidocaine, but it's actually the needle that's important to help get rid of that disorganized tissue and help it relax. And so remember, because it's the needle passing through that painful area, it's important to do the stretching. Once the needle goes through, then you gotta do the stretches with this treatment in order for it to work the best. And a lot of times it's gonna take a couple or a few of these to really help relax the area and get it back to normal. It's okay if you feel a little bit more sore afterwards. So you may feel good, you know, after leaving the doctor's office, but then it's gonna be real tender that night or maybe even the next day, just because we've put in the needle into that really painful area. So what other treatments are there? So there are a lot of different treatments. You do have to be a little bit careful. So the next few treatments that we talk about don't have a ton of evidence around them, but for some people they're going to be extremely helpful, so it may be worth trying. So some of those other treatments include things like laser therapy, ultrasound that you could do like at the physical therapy office. They could also try like a TENS unit. A TENS unit is where you put little electrical pads over the painful area, and it provides little low-level electrical stimulation to that spot to help kind of relax the muscle. You can also get one of those on Amazon. Again, we'll put a link below in the description. More treatments, so other people will do things like acupuncture. Sometimes acupuncture can be really helpful in these situations where a lot of your pain's coming from the muscles, the ligaments, the soft tissues. So acupuncture can sometimes be beneficial as well for these muscle knots. Another treatment that's been reserved mostly for those refractory cases that just aren't getting better is something called Botox. So a lot of times we think of Botox to get rid of like wrinkles in the face. So really what Botox does is it helps to block that chemical that's leaking in these painful muscles. Remember that acetylcholine? So it helps to relax the muscle. And so injecting Botox into the painful muscle knot areas may help them to relax and kind of calm down. So if you've ever experienced a really painful, pesky muscle knot, please leave your story below. So if you have any other questions or comments, leave those below too. If you want to check out any more of my medical videos, make sure you click on this one right here. Don't forget to subscribe, and I'll see you guys next time.